So let's talk a little bit about hospital at home. I know that's something that your organization is definitely involved in, and just maybe we can start about. Let's start the talk. Like, what are some of the services that a patient would need in the home? Once they're just discharged, either short-term, long-term care. What are we looking at?
So, in terms of hospital at home, that program is specific to a patient's never admitted into a hospital room.
Okay.
They are admitted into their home with the hospital bed, all the medical records, the point of care staff that needs to care for them. And so that's the primary, I guess, premise around hospital at home. Virtual care is a little bit different in terms of patients admitted into the hospital, they get whatever services they need, and then they're discharged to their home, and they might have virtual care telehealth experiences or physical therapy or long-term care. But the hospital at home are acute care patients that are just, instead of being put in a patient room, are put inside their home where they can get better care. They've got their support system, higher quality measures, higher patient satisfaction. It's just a really cool program.
Right. So from a cybersecurity perspective, I would imagine there's some serious challenges there. Maybe you could outline a few of those in terms of maybe like the types of data that's being funneled back and forth, et cetera.
So it's exponentially more complicated in hospital at home programs. So if you think about a traditional cybersecurity program in a hospital, you have visibility into all the devices that are connected into the network. You're doing your due diligence in terms of consuming the logs to identify potential anomalous behavior. You're doing vulnerability management, patch management, asset management, like all of the things that are foundational to cybersecurity. And you can do those not easily, but you can do them effectively because everything's connected into the network and you've got that visibility. When you're sending things to a patient's home, you either have to connect to that patient's home network, which is not advisable, or you have to drop some version of a proprietary network into their homes, connect all of those devices, and then that network needs to somehow send the data back into the hospital. And that is usually facilitated by some kind of cloud-based service. So the complexity is exponential in terms of you have to figure out how to secure things in somebody's home, a foreign environment. Then you've got to worry about how it's being sent into the cloud, another foreign environment, and then you've got to figure out how to get it back into the hospital's network and systems while still maintaining the life cycle of security, not just from a data perspective, but also from a malware protection and other cybersecurity threats.
So a couple of things are coming to mind. One is like, how do you stay compliant with whatever regs you need to, because so much is out of your control. And two, like in terms of developing this type of program, security almost has to be in on the ground floor of kind of just putting this together before it even goes out the door, right?
So I think your point about security being in from the ground floor is really, really important and critical in having a really successful hospital at home program. If cybersecurity isn't at the table as you're designing the hospital at home program, and then they come in afterwards as an afterthought and have to bolt on security, it's almost impossible to do so. You really need to build it into the fabric of the program as it's being designed so that all of the core components of just cybersecurity hygiene are embedded into the architecture that's going to be delivered inside a patient's home. Yeah. I mean, ultimately it comes back, it's all about risk management. Sure. And so it's about managing the potential risks of things being in somebody's home. It's also about managing the third parties that we have to rely on, either to provide the services inside the home or to provide the cloud services that are a conduit to getting everything back into our internal systems. And so to have cybersecurity embedded from within can help to design a really effective program that can help the organization be successful.
And in terms of buy-in, obviously the value of the program itself speaks for itself, but in terms of selling, the need to implement these extra security measures from the ground up, was that a difficult sell? Are you still find yourself evangelizing that kind of need?
So I am fortunate enough to work for an organization that really understands cybersecurity, and it's been embedded into the culture of the organization. So I never have to seek an opportunity to have a seat at the table. I am sought to have conversations from the initial phases of any initiative like this one. And so I haven't had to evangelize. I've just had to be part of the value proposition that is being delivered. And frankly, we started as a very small, methodical pilot, and it just grew exponentially because of just the value clinically and from a patient satisfaction that it realized.
Right.
It's been really interesting and exciting.
So how are you measuring success for your part of the program?
Much like we do everything else.
Yeah.
Like, are we having major incidents? Are we positively impacting the program? Right? Cybersecurity can be obstructive if it's not designed properly, but it can be really effective and enabling if it's designed properly. So knowing that the measures of success for the program are aligned with the measures of success for the cybersecurity components are what's really helping us to understand, are we doing what we should be doing, and are we helping our organization be successful in their mission and vision?
Mm-hmm. Are there any baselines that you kind of require from the home network, for example? Are you tapping into anything, on their end that you would need like a baseline for?
So we don't tap into the patient's home networks. We always deliver our own proprietary network. And so the baselines are the same that they would be for things that are connected onto our network. Even though it's not technically connected into our network, it's still a network that we are effectively managing.
Sure.
And what it's helping us to do is to really understand, in order to scale this out to an enterprise-wide capability, what security capabilities do we need to build on to effectively grow the program? And so what we're doing today is not scalable to the degree that it needs to be if we really want to run with this, which we expect to. And so thinking through, how do I partner with our cloud security and network providers to be able to leverage some of their virtual private networks to, instead of delivering physical individual networks into the patient's home, can we leverage cloud-based virtual private networks to deliver cloud-based virtual networks into the patient's homes to be more elastic, flexible, and scalable is one of, that's going to be sort of version 2 of where we need to go to be effective.
Mm-hmm. And what about response activities in case there is some kind of incident, whatever it might be? Any different than you'd normally handle
So currently we leverage third parties to assist us with that. We don't have the staff to be able to scale out to the degree that we would need to in a fully fledged hospital at home program. So future-wise, we'll have to do one of two things: either build out the program to have the staffing that would enable us to deploy security professionals out to the homes, or at the very least leverage those cloud-based capabilities that I mentioned to be able to do things virtually and remotely like we would if IT is in a completely different building than most of our hospitals. So even in that vein, in an incident response scenario, we would most likely still be remote. And so it's really just designing the capabilities to be able to do it either on our own or partner with a third party that can sort of augment our capabilities to be able to still deliver security and incident response to the home.
This is a really unique take on remote access than kind of the general stories, especially here, that we've been hearing. This is really fascinating.
It is, but honestly, like the measures speak for themselves. Patients get healthier faster. The quality measures are through the roof. The patient satisfaction scores are through the roof. People want this. And so if we can actually utilize this to deliver higher quality, lower cost, more satisfaction, it's the right thing to do. It's where healthcare has to shift there. And we just happen to be one of the first ones to adopt it.
Can you, I mean, I don't expect you to give me numbers or anything, but can you give me kind of a sense of the scale of what you guys are doing in terms of patients and kind of care that's being delivered?
So we started this program, I would say probably summer, fall of last year. Again, with the approaches, we were just going to do a couple of patients and see how it went. By early winter, late winter, early spring, we had hit our 1,000th patient. Unexpected. And I don't have the numbers, but given how we scaled up, I would be surprised if we're not about to hit 2,000 or if we haven't already hit it. It's the adoption has been through the roof. The success has been through the roof, and I expect for us to continue with the traction that we've gained and grow this program quickly.
Is there anything you can point to, one or two things that have really driven this success? From a cyber perspective.
From a cyber perspective, it's really working with our clinicians so that they understand that we still have risks that we need to manage. And that doesn't change because they're in somebody's home versus inside the network. And the fact that it actually becomes more complicated when they're in somebody's home. So that inherent partnership between our strategic partners, our clinicians, and the cybersecurity team has been critical in us being able to enable the program, because that's our job, right? Like, our job is literally to enable the organization to achieve its mission and vision, and this is no different. So being able to partner and demonstrate that, you know, our core mission is their core mission, I think has been really important to the success of the program.
You know, it's funny, I've done a bunch of these this week, and inevitably the conversation comes back to culture, whether it's a factory floor or a healthcare situation like yours. Culture is part of this discussion in terms of enabling cyber in some fashion.
It is. I was just in a previous conversation where folks were talking about, you know, us versus them, and I sat back and didn't say much, and then finally was like, I haven't said much because I have a different perspective. I'm one of them. I am an executive on our executive team, and my core values and goals are the same as everybody else in the organization. And if we just take that approach, then culture will build on itself, because I'm not bolting on cybersecurity. I am building cybersecurity as part of the core mission and vision of the organization. And if we can do that together, it's a lot easier to be successful collectively. It's all about culture.